All right, after health promotion of infant and family, we have the next stage, which is health promotion of the toddler and family. And the toddler is also known as dun 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 the terrible twos, age 12 to 36 months, or age 1 to 3 years. This is marked by an intense period of exploration. Temper tantrums are both a good and bad thing. The good part about temper tantrums and the child being obstinate, they occur frequently. They are marked by a learning growth of exploration un, of independence and and without an ability to express verbally what they need. So often the tantrum can occur. That's the good part about it. The bad thing is it can be quite frustrating to work with the child when they are occurring frequently, and just understanding and aid with the family is something really important to just help them go through this stage and knowing that this stage ends. Also marked by this toddler time period is the successful mastery of these developmental skills. And these developmental skills are advance with assurance and guidance by the family. So the temper tantrums, although they're a point where the parent needs to help guide the child and not give in to those temper tantrums, there are also a need for the child not to be punished necessarily for those temper tantrums, but to help get through that temper tantrum so that these developmental skills, so the child feels loved and accepted, and then can continue to work through those developmental skills. Temper tantrums may occur if the child isn't able to, for example, get their pants on when they're trying to dress themselves. And so helping guide them through that is important, and that helps with the trust and the guidance of the family, of the parents. Biological development, what's happening with the toddler, the weight gain slows to 4 to 6 pounds per year. At this point, the birth weight should be quadrupled by 2.5 years. Height increases, growth is step-like rather than linear. The adult height is 2 times the height at age 2 years, so that's often a predictor of how tall the child might be when they become an adult. The anterior fontanelle closes by 12 months. So you do want to know this biological development slide. What is happening with the sensory changes? Visual acuity is continuing to improve. 20 to 40 is acceptable. Most adults prior to their loss of visual acuity is 20/20, and how you are assessing a child's vision is by pictures or shapes, if they're able to see those, or directions of which way of a letter or shape is pointing, since they may not know their letters at this point. But you do want to understand if they know what those shapes are, or if they do know what those pictures are. Their hearing, smell, taste, and touch increases, and just like the infant, they use the senses to explore their environment. So now their physiological systems, differing by the infant, at the end of toddlerhood, their physiological symptoms should be relatively mature. Their inner ear structures still are short and straight. Their tonsils are large. So this physiological system still predisposes them to infection. This at the toddler time, sphincter control at age 18 to 24. So this is a time to be helping the parent with anticipatory guidelines for toiletry readiness. Gross and fine motor development. So if walking by 12 months is if they're not walking by 12 months, again, you're assessing all their other developmental status. It could be temperament, it could be place in the family. They may be able to run by 18 months, climbing stairs. They have improved coordination. Some of the fine motor development, they should be able to throw a ball, they may be able to draw circles, and these in pre-K or daycare institutions, they work on things like that with pouring in Montessori schools, or with throwing. All these play activities help their fine motor development. Psychosocial development. So with those tantrums, those are the development of independence and self-control. At this age, in the Erikson stages of development, you have the autonomy versus shame and doubt. This is one thing that's really important with the toiletry training. If they are working on toiletry training and they have an accident or an accident at nighttime, it's really important to not ridicule or discipline the child for that accident. You want to continually guide that child into the right behaviors. Otherwise, this autonomy versus the shame and doubt can come into play. Ritualization provides a sense of comfort. We talked about that. They may have their same book that they are reading, their same TV show, their same plate that they're eating from, some of the same foods. And that just actually, again, helps that them continue to develop. Cognitive development in the Piaget cognitive theory, sensory motor phasers. So these are the next two stages that, remember, Piaget has 6 stages, and the last 2 are in the toddler age. You have imitation and domestic mimicry. So you'll see the child wanting to sweep and want to clean and mimic vacuum cleaning, etc. If the caregivers can integrate that to help the child and give them tasks or chores pertinent to this age, that's great for the child to develop. Awareness of causal relationships between 2 events. So this has to do with problem solving and operations. So it's a sense of discovery for them. Here's just a picture of the domestic mimicry where they're helping clean. Okay. Preconceptual phase begins at about age 2 and it lasts until age 4. So this is a dramatic increase of language. Again, don't be alarmed if the child does not have a dramatic increase of language, but again, looking at the place in the family, how if there are 2 languages spoken in the household. The concern with why and how. So they may be asking why, and it's important to continue to answer these questions when appropriate, because it helps them understand these concepts. The toddler's spiritual development often parallels with their cognitive development. They are beginning spiritual routines with their family, maybe praying at nighttime before they go to bed. The religious teachings and moral development influence toddler behavior. So it's really, has to do with some discipline, but this is really centered on the family's rituals. Development of body image also closely parallels with cognitive development. Self-aware, They're able to refer to their body parts by name. It's really important to avoid negative labels about physical appearance. That can set them up for body image disturbances later on. They are able to recognize gender differences by age 2. Um, this is really common especially in daycares or preschool areas where there are multiple genders. Children at home understand gender differences more in adults rather than if there are no other siblings around. Development of sexuality, exploration of genitalia is common, so that should be reassured to the family that the child is exploring their scent. Remember, they explore by all senses, so they are looking at themselves. They understand the genders, and they may participate in touch of their genitalia. Gender roles are understood by Toddler, so and those are the gender roles that are in the family unit. So if the dad stays at home, they might understand that gender role is at home until they start to see how other families are. Gender identity is established by age 3 years. You may see the children exhibit the play of playing house. Social development, differentiation of self from mother and from significant others is a major task. And so that continues. It begins in the infant age with the separation anxiety and then continues throughout the toddler age. Increased awareness of object permanence, starting again in the infant age and going on into the toddler age. Transitional objects can provide security. For example, if the mother works and a babysitter comes in or a caregiver, there might be certain transitional objects that help the child, like, oh, well, this is their bear for when they go to preschool, or this is their bear when they go to sleep. And some of the things that can help that is only using those transitional objects during those time periods just to kind of help their security. Increased level of comprehension in language, ability to understand. They may comprehend 300 words by age 2 years, but at the age of 2 years, the minimum is a two-word phrases. That's the minimum criteria. Of course, children tend to be increased again depending on what languages are spoken at home and the order of the children in the home. At age 3, they can use simple sentences and they acquire 5 to 6 new words a day. Gestures precede each language milestone up to 30 months of age. So you might see, and there's a lack of research as to where that comes. My personal theory is how we use our hands to communicate and our gestures to communicate as well. This is with sign language in children. There's some theories that suggest it can decrease children's anxiety or frustration and not being able to communicate by using sign language to help with their communication. Personal social behavior. Toddlers start to develop those skills of independence, and remember those tantrums that we talked about. Mood swings may be common. Independence may result in tyrannical, strong-willed, volatile behaviors. This also depends on the child's demeanor. It depends on how the nature of that child is. Some of the skills of independence that they enjoy and that should be promoted at this age would be feeding themselves, playing, coloring, blocks, those fine and gross motor skill development, dressing themselves, undressing themselves, being helpful. Play, we talked about parallel play at this age, imitation, little emphasis on gender stereotype toys. They may be aware of gender and gender-specific items, but it doesn't faze them. The girl might put the fire hat on, even if their daddy is a fireman. So there's the child does not necessarily differentiate. Increased locomotive skills. So educational toys and books are helpful just to help increase, not so that the parent is helping the child be a Rhodes Scholar and heading for Ivy League school, but to help their gross and fine motor and cognitive development. Tactile play, remember this age group has, takes in all information with all their senses. Appropriate safety in relation to size, shape, risk for toxins, and sturdiness of toys. So and of course this is age related. So the 12-month-old, the new toddler might need bigger items to be playing with, so that there no risk for choking. And again, they may still be very oral sensory, versus the 3-year-old who might not need that. Coping with concerns related to normal growth and development. So we talked about toilet training, asking the parent to look for signs of readiness, and that's the sphincter control, the watching other siblings use the bathroom, or other ages if they're in pre-K, looking for that readiness. Sibling rivalry, so this happens, the normal pecking order in households, but again with that independence need. They may desire the sibling help, they may not desire sibling help. We talked about temper tantrums. Negativism, it may even come from using the word no to try to set the boundaries. And regressive behavior. Regressive behavior is when a new child is introduced, where, let's say, the toddler has learned to has been completely toilet trained, and a new infant comes along. The toddler might regress to no longer being able to hold their urine or their stool. They may regress to having accidents, and that has to do with seeing the attachment that the new arrival has to the parents or the caregiver, and it's a subconscious desire of the toddler to have that affection and attachment. So making time for that older child, spending time with them, can help with those regressive behaviors. These are some of the markers of the assessing readiness for toilet training. And here's a picture. Reverse fashion can help the child from not falling in the toilet. I still remember my mom putting me on the toilet backwards so I wouldn't fall in. And then B, of course, has the little toilet trains with the small potty chairs that are actually at the level of the child as well. Optimum Health during toddlerhood. So we're looking at nutrition, and we do follow the MyPlate recommendations with the portions. The child does need calcium and may have a lot of milk during the day. The child might graze. They may need, now remember the size of their stomach. Their stomach is not as big as adults, and adults can go hours without eating, but children do need snacks. They expend a lot of energy throughout the day running around, and they do need to have some of those snacks. Phenomena of physiological anorexia. Sometimes the child will have different needs, and it may seem like the child's not eating one day, and then the next day they are eating everything in sight. So there are some inconsistencies with the child, but so you are looking at how the child is doing overall, and they may be picky. They may go with their routine, and they like to eat certain things. Um, they might respond well to fun, like food coloring and eggs. If you're doing Dr. Seuss and you're eating green eggs and ham, and so they might respond to some of those if you are having children with picky eaters, or refusing food. But you do want them to um, balance, and you're looking at their overall growth, not from day to day, as it may fluctuate. Sleep and activity decreases 11 to 12 hours. They really do need a nap still, and then has an adult sleep pattern by age 3 years. Dental health, you're continuing with that. Limited sugar in the diet. They shouldn't be going to bed with bottles or cups. They should be limiting those just to prevent the caries or any rotting. This is just an example. Injury prevention, again, the anticipatory guidelines with depending on age. Motor vehicle safety, there are state laws for motor vehicle safety with boosters and safety in how the child should sit. It's based on height and weight, so that the belt goes around the hips rather than the abdomen. You can see the special plastic caps and electrical sockets. This is a little girl that is in household cleaning cabinet rather than it should be having the clips to protect those children, or those cleaning substances should be up there. The nurse is discussing with a parent group the importance of fluoride for healthy teeth. Which of the following recommendations should be made? And the recommendation should be determine whether the water supply is fluoridated. So that is something that needs to occur, and that can be discussed with the dentist. All right, that's it for toddler and family.